Good morning. Good morning. This is Nurse Eunice with Florida Training Academy, and today we're going to practice some CNA questions to help you prepare for your future CNA examination. So, if this is your first time here, welcome. We'd love to have you. We get started in about 10 seconds because that gives our students notification and time for them to actually sign on and watch the video with us. So, it's interactive. Feel free to put your comments, the responses to the questions in the chat, and also, if this is your first time here, if you're not already subscribed, please consider doing so. And don't forget to like the video because that helps us with the Google Analytics and helps share our content with others. So let us go ahead and begin. And good morning. So, number one, which of the following actions is the best way to prevent the spread of infection in healthcare settings? Good morning, Karen. Is it A, wearing gloves at all times? B, using alcohol-based hand sanitizer? C, washing hands with soap and water before and after patient contact? Or D, wearing a mask? And Karen, your video will be tomorrow. It took longer to complete than I thought. So tomorrow will be oxygen therapy. But yes, everybody, you're correct. C is the right response. Washing your hands with soap and water before and after patient contact is the most effective way to prevent the spread of infection. Number two, a patient with a nasogastric tube should be positioned in which of the following ways to prevent aspiration? A, flat on their back, B, Fowler's position, C, supine position, or D, Trendelenburg position. Can't trick you all. Great job, team. That's right. So, whenever you have somebody who has a nasogastric tube or a tube that's inserted through the nose, the nostrils, and it actually goes into the stomach, we can use that to decompress the stomach. Let's say they were vomiting. So, we would connect the NG tube to suction, or once their stomach issue is resolved, we can also use the nasogastric tube to feed them. We could connect it to a tube feeding. So the patient should always be in the Fowler's position to reduce the risk of gastric contents from entering their airway. Number three, what is the most important reason for using proper body mechanics when moving patients? Is it A, to avoid injury to the patient, B, to prevent muscle strain and injury to the healthcare worker, C, to comply with facility regulations, or D, to reduce time and effort? And these questions start off easy, but we're going to work our way towards the harder questions. And of course, I expect you all to get these correct because you are super smart CNAs. Yes, it is to prevent muscle strain. If you don't use proper body mechanics, if you don't move the bed up to a working height, if you twist too fast, if you try to lift with your back and not with your thighs, your leg muscles, you're going to injure yourself. Number four, when measuring a patient's blood pressure, which of the following actions should be avoided to ensure an accurate reading? A, positioning the arm at heart level. B, using a cuff that fits properly. C, having the patient sit quietly for 5 minutes before measurement. Or D, taking the measurement over clothing. Which should be avoided? Do, 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 do. Yes, Farida. Yes. So for this one, the response is D. You don't want to avoid using a cuff that properly fits. You want to use a cuff that fits properly. So the correct response is D. I know you see us do it in the real world, even though, especially when we have those with fragile skin or those who say that the blood pressure cuff hurts their arm, we may, you may see us leave the sleeve down, but technically, the blood pressure cuff should be on bare skin and not over clothing because it could lead to inaccurate readings and interfere with the cuff's ability to measure the blood pressure properly. Remember, it needs to be able to sense those pressures, and the clothing would serve as a barrier. Number 5, which of the following is a sign of hypoglycemia in a diabetic patient? Diaphoresis, bradycardia, hyperactivity, or polyuria? I think you all are looking this one up. I don't see too many responses for this one. I got you thinking hypoglycemia. Hypo is the prefix that means low. Glycemia refers to the blood level within the blood, excuse me, the sugar level within the bloodstream. So, what happens when a person's blood sugar is low or if the blood sugar drops? And for this one, I want you all to write down this term because you all weren't familiar with it. It is diaphoresis. They get sweaty, but it's not sweaty because of heat. It's excessive sweating because their brain is trying to adjust to these low blood sugar levels. And so they can also become shaky and confused once their blood sugar levels drop. So consider that a medical emergency and get the nurse in the room. Anytime you see that your diabetic patient is sweaty, they're shaky, they're confused, and may complain of a headache, that could be an indication that those blood sugar levels are lower than normal. Number 6, a patient with a history of chronic obstructive pulmonary disease, also referred to as COPD, is receiving oxygen therapy. Which of the following oxygen delivery methods is most appropriate? Is it a simple face mask, a non-rebreather mask, a nasal cannula, or a Venturi mask? So, Karen, this is why the slides that you requested are going to take so long because I have to go through and add all this information into those slides. So, which one is the most appropriate device for somebody who has chronic obstructive pulmonary disease? And if you chose, let's see, I'll wait for 3 more responses. 1, 2, and 3. So if you chose C, nasal cannula, you are absolutely correct. So often for those who have COPD, they can only have low flow oxygen delivery devices, such as a nasal cannula. So when you start thinking of the mask, those can usually give higher quantities of air. And so in this image, the person's still mobile, they're able to enjoy their life, they have their portable oxygen tank, but they also have their nasal cannula with them. Number 7, a patient complains of being lightheaded. What should be the nursing assistant's first action? Do we want to administer nitroglycerin, call for help immediately, take the patient's vital signs, or reassure the patient and stay with them? You're walking Mrs. Lucas, and she begins to feel lightheaded. What do you do? All right, I'm seeing a lot of C's, but I need for you all to call for help. So remember, this is a medical emergency, or it could potentially be a medical emergency. So if you're walking her, you can get her to a chair. You can help assist. It's not a fall if you help. You can assist her to the floor, but you need to be screaming, help. And then once you have help, we can worry about those vital signs. So calling for help is the immediate priority action to ensure the patient receives prompt medical attention for a potential life-threatening condition. Because whenever a person becomes lightheaded, it could be because of blood loss, low oxygen levels, low blood pressure. And so you taking the vital signs isn't going to help us determine what is causing their lightheadedness. So make sure you call for your nurse. If you're in a home care setting, you'd be calling 911. Number 8, which of the following is the primary purpose of using anti-embolism stockings? We refer to those as TED hose. Is it to provide warmth, to support weak muscles, to reduce swelling in the legs, or to promote venous return and to prevent blood clots? Why are we asking you to put those tight stockings that take a long time? Why do we ask you to put those on the patient before you get them out of bed? And we keep them on while they're in the bed for a few hours. Usually, we may take them off. Your doctors will let you know how often you can take off those TED hose. But why do we put them on in the first place? Yes, Giovanni. Yes, Shamika. Yes, Farida. So, yes, you all. It helps to promote venous return. So all that stagnant blood that's in their legs, we need that to return, to go back up to their heart. And the more that we can return this blood, aka get it flowing, the less likely they are to develop a clot. So that's why they call them anti-embolitic stockings. And so here is a picture here. I do have an old video. I'll see if I can get a new one up that shows you all how to actually apply the stockings. But in the real world, we call them TED hose. Number 9, when assisting a patient with ambulation after surgery, which of the following is the most important safety measure? A, providing the patient with pain medication beforehand. B, ensuring the patient wears socks. C, encouraging the patient to move quickly to build strength. Or D, using a gait belt for support. Hello, Barad. All right, what's going to be the safest? Yes, Chandima, Sandra, and Nuxa. Hello. Good morning. You all are absolutely correct. It is D. You all did not get tricked. We're not going to walk anybody with socks on. They need to have the socks with the grippies, not traditional socks. So they need something that has some type of safety feature to prevent falls. So you all were correct. You did not choose B. The correct response is going to be D. You're going to use a gait belt to help support that patient. And using the gait belt, you would actually hold the belt securely. So what I find with CNAs when I'm training them to pass their hands-on, their clinical examination, is they don't want to hold the belt with all of their fingers. Usually a finger is sticking out. So I want you to imagine you're walking somebody who needs your assistance and you're only holding a belt with 3 fingers. They're going to slip out of your hands and hit the floor. So all 5 of your fingers, if you're using 2 hands, all 10 fingers should be around that belt and you assist the person to walk. And that's going to help to prevent a fall. Number 10, which of the following task is appropriate for a nursing assistant to perform when caring for a patient with a urinary catheter? A, inserting the catheter. B, measuring and recording the output. C, irrigating the catheter. Or D, removing the catheter. What is the appropriate task for a nursing assistant who's not been trained to work in a hospital? You're not doing any insertion. You're not doing any removal. So what do you do instead? Yes, everybody, you measure and record the output. So measuring and recording output is a task that falls within the scope of practice for CNAs. And so what goes in should match what comes out. So if your patient drank 2 glasses of water with breakfast, I expect within 2 hours to see 2 cupfuls of urine, the equivalent in that bag. Otherwise, there could be a kink or your patient could be retaining urine. So again, what goes in should match what comes out. 11, a nursing assistant finds a patient lying on the floor. What should be the first action? A, assess the patient for breathing and a pulse. B, help the patient back to bed. C, scold the patient or the resident. D, report the incident to the charge nurse. Or E is A and D. Oh, your patient's just lying on the floor. They had nowhere else to lie. They just decided to lay down on the floor. Don't trust them. What are you going to do? All right, so Rhythm says A, Barad says B, All right. Yes, Chidama. Yes, you're going to do A and D, you all. That person may not be with us any longer. They could be in cardiac arrest. So just because someone's lying on the floor, you still have to assess them and you're going to call for help. So it's going to be A and D. You're going to assess the patient for breathing and a pulse. And you're also going to be calling out for the nurse. Even if they are breathing and they're still alive, you cannot pick that person up by yourself. It requires a team lift. That nurse needs to be notified. And as always, if you're in a home care setting, when I say nurse, initially you're calling 911 first, and then you would notify the nurse or the supervisor at the nursing agency separately. Number 12, this is easy. Which of the following foods is the best source of dietary fiber? Is it chicken breast, white rice, an apple with skin, or ice cream? And it's going to be 95 degrees here today in Jacksonville, Florida. So some ice cream sounds perfect. Yes, Barad and Karen. Yes, the apple with the skin because the skin is nutritious. So, an apple with a skin is a high fiber food. It promotes digestive health and regularity, meaning the frequency of the bowel movements. And this is essential for the overall nutrition and well being. And so, other things that contain fiber would be some of your whole grain cereals like Total, Fiber One. So if your patient is not having bowel movements as frequently as possible, the CNAs can help with that. You don't give medications, but you can use high fiber foods and add water. So after they get to eating their cereal and milk, give them a cup of water. That will hopefully, the fiber bulks up the fecal matter and the water will make it easier for it to pass through the digestive system. Number 13, which of the following symptoms might indicate that a patient is experiencing a urinary tract infection or a UTI? Is it a high fever, hematuria, constipation, or decreased thirst? I see we're torn between A's and B's. We have a lot. We have a lot. Now I want you to think about it. If you've ever had a UTI, you probably never had a fever. Unless it was severe. And when I show you this next slide, usually when someone has hematuria, it's not gross, like gross being a large amount or a large quantity. So that's a medical term whenever there's a lot of something. So there's going to be blood in the urine from the irritation, but it may be microscopic. So this one isn't the best image because it shows somebody who would more than likely have a severe UTI. But yes, whenever you have that irritation down below and you urinate, if we put your urine under a microscope, we'd probably see some blood. So blood in the urine is referred to as hematuria, whether it is microscopic or gross in the quantity of the blood. Number 14, a patient with Alzheimer's disease is becoming increasingly agitated. Which intervention should the nursing assistant implement first? Do we want to restrain the patient, administer medication, leave the patient alone, or use a calm and reassuring approach? They're becoming agitated. What do you want to do? So I see C, I see D, I see D. Yes, you all. So you're going to use a calm and reassuring approach. So with our Alzheimer's patients, sometimes we can't leave them alone for safety. So we need to try to de-escalate, to try to calm them down without ever saying the word calm down. So we have to find out what is causing them to be so agitated at this point. So de-escalate the situation, soothe an agitated patient without the needs for restraints or medication. And again, you don't want to leave an agitated person with Alzheimer's alone because they could injure themselves. Number 15, a patient has an order for an NPO status. Which of the following actions should the nursing assistant take? Do you want to remove the water pitcher from the room? Do you want to provide the patient with clear fluids only? Offer ice chips every hour? or encourage the patient to eat small, frequent meals. A patient has an order for an NPO status. So this requires you to know what the medical term NPO stands for. And NPO actually stands for nothing per oral, but no one says it like that. We just say nothing by mouth. So NPO, you're going to have to remove the water pitcher from the room, because if you leave that pitcher in the room, I don't care how many times you tell Miss Lucas she has a procedure in 30 minutes and she can't eat or drink. As soon as you tell someone they can't do something, they want it even more. So go ahead and take the pitcher away and make sure if you do leave it in the room that you leave it in the room with nothing inside of it. Number 16, when performing perineal care for a female patient, the nursing assistant should wipe A, from front to back, B, from back to front, C, side to side, or D, in a circular motion. If you do D down there, you're going to jail. We will report you. Yes, Rangita. Yes. Great job, everybody. It is going to be from front to back. And in this image, we didn't show anyone a depiction of anyone cleaning the front area, but Florida Training Academy has clinical skills playlists. So there's videos of me doing perineal care on a woman, and then there's another video of Matthew, who's also a nurse, performing perineal care on a male. So if you need our clinical skills videos, just go to our playlist. But yes, you always want to wipe starting from the cleanest area towards the dirtiest area. So you clean the vagina first, turn them to their side, and that's when you would clean their rectum and their buttocks. Number 17, the nursing assistant is helping a patient with passive range of motion. Which of the following is a key principle to follow? Is it A, perform exercises quickly to avoid fatigue? B, force each joint to its maximum range? C, support the joint being exercised? Or D, perform exercises only once per day? Super easy question. All right, we'll be revealing the answer in 3, 2, and yes, everybody, you always want to support the joint that is being exercised because it prevents injury and ensures the exercises are performed safely and effectively. In addition to supporting the joint, look at the joint, because if your person is nonverbal, you can tell if maybe a joint has dislocated, but if you're looking towards the joint and also looking towards your patient's face, you could tell if they're grimacing, and that should be a sign that you probably either need to slow down your activities or stop altogether. Number 18, what is the purpose of a bowel training program for a patient with chronic constipation? Is it to increase the frequency of bowel movements, to establish a regular bowel management routine, to promote the use of laxatives, or to enhance dietary fiber intake? A bowel training program. This person has been incontinent, so they have been soiling themselves with fecal matter. What do we want to do to help them? Yes, Bharat. Yes, so we don't say potty training when we're referring to adults. It is either bladder or bowel training. So the correct response is going to be B. To establish a regular bowel movement routine, it helps to prevent the person from developing constipation, and it also promotes regularity. So kind of like a kid, take them to the bathroom more frequently. But again, we can't use the term potty training for adults. It is bladder or bowel training. Number 19, a patient with difficulty swallowing is at risk for aspiration. What should the nursing assistant do to minimize this risk during the feeding? Is it offer large bites of food, position the patient lying down, provide thin liquids, or encourage the patient to take small bites and chew thoroughly? How do we prevent aspiration? Yes. You all selected D. Yes, have them slow down, chew their food. And if they can't chew it, the next image, I'm giving you a disclaimer, might be disturbing, but here we go. All right, so my pet peeve. I need for you all to make sure that the diet matches the dentation. So we just talked about chopping up this food or making sure the patient takes small bites. Somebody who doesn't have teeth cannot take small bites, and I don't care what they do at home. Once they are in your care, you are responsible for them. So if she had ordered something and you obviously see she cannot take small bites, I'm going to need my CNAs, who are such great caregivers, to literally sit there and cut up all of the food. And then when you get through cutting the food, you're going to come and let me know what happened. And I'm going to go back in. I'm going to joke. I'm say, hey, Miss Lucas, girl, where are your dentures? And she's going to say, I don't have them. And I'm going to be like, can your family bring them? And if she says no, she cannot get a regular diet. She's going to get something that's going to be mechanically soft so that she can eat it with her gums since she doesn't have teeth. So your job as a CNA is just not to prevent aspiration by sitting them upright. It's to prevent aspiration by making sure that if they have dentures, that they use them. And if they don't have dentures, you cut the food and you notify the nurse. Number 20, which of the following is the best method for a nursing assistant to use when communicating with a patient who has hearing loss? Is it speaking loudly and quickly, using a communication board, writing down instructions, or speaking in a high-pitched voice? Someone has hearing loss. What should we do? All right, I see a mix. I see B's, I see C's, I see you all teetering, you're tottering. And what I want you to think about C is, what if the person with hearing loss is from a different country, so they don't know the English language, or if they are illiterate and they can't read. So if if B wasn't there, C would be the most correct response. But you all, for this one, I want you to use a communication board because it shows pictures. And here's an example of a communication board. So it has a picture of the bed. It has the arrow going up, the arrow going down, has a picture of a light switch. Some of them have pills, cups of water, pictures of toilets. And so instead of writing things out, most of your facilities will have these patient communication boards, and you can get the person to point to it if they have a hearing loss or if they have English as their second language. Number 21, a patient is on a low sodium diet. Which of the following foods should be avoided? Is it fresh fruits, canned soup, plain rice, or fresh vegetables? Which should be avoided if a person's on a low sodium diet? And Barad, you can stop apologizing, dear. We're all here to learn together. So for this one, yes, it is going to be B, canned soup. Anything that is processed that can stay for a year in a can more than likely has preservatives, aka salt, and a lot of it. So anyone who's on a cardiac diet is going to require low sodium. So they usually cannot have any processed foods or canned foods. Canned fruit would be different because usually it's going to have sugar. So your diabetics can't have canned fruit, but you would definitely not want to give them canned soup. Anything that's like oodles or noodles or anything of that is going to make their condition worse. Number 22, a patient with congestive heart failure or CHF is experiencing edema. Which of the following interventions is most appropriate? A, encouraging increased fluid intake. B, applying compression stockings. C, elevating the patient's legs. Or D, restricting physical activity. Congestive heart failure. The heart is failing. So the pumper isn't pumping properly, and it's going to result in fluid overload, swelling of tissues. What does the CNA do in order to help somebody with swollen legs? Let's see. Kind of, sort of. It's going to be C before it is B. So the easiest thing to do is to elevate those legs. Now, in this image, we have somebody with pitting edema. When you press your finger in it and that indentation lasts for 1, 2, 3, 4 seconds, that determines the gauge or the severity of the edema. So you want to elevate the legs. And then, of course, your doctor will also usually prescribe those TED holds, those compression stockings. But when those compression stockings go off, this person still needs to have their legs elevated. So that's why that is the better response. Number 23, a nursing assistant notices that a patient's urine is dark and concentrated. What is the most likely cause? Dehydration, urinary tract infection, diabetes mellitus, or high protein intake? I'm doing my nurse dance. Stephen, Mary, Karen, Shamika. Yes, everybody. Great job. That is a sign of dehydration. And if you've watched one of our other videos, we know that we're going to give fluids. And if you have cranberry juice, not like a cranberry juice cocktail, but if you have cranberry juice, something that is a little bit acidic, that is going to help promote the urinary tract health, because the acidic drink makes the urine acidic and it helps to kill those germs. All right, so dehydration whenever the urine is dark. All right, and so this is which of the following, I'm going to go to the next slide. Which of the following is the most appropriate response if a patient starts to vomit while laying in a non-medical bed? So this is your home care patient who's in bed, a bed that doesn't move up and down, and they start to vomit. What do? Do you panic? Do you place a tongue depressor in the mouth? Do you turn the patient onto their side? Or do you prop the patient up with your hands or a pillow? Patient is vomiting. They're retching. What do you want to do? Yes, yes, yes. Everybody has the right answer. It is C. You get them onto their side. Don't try to hold them up while they're vomiting. Number one, they can vomit on you. You're going to turn them on their side. That's the easiest thing, and it's the most comfortable for you and your patient. Turn them onto their side. If you have an emesis basin, you can put that beneath their mouth. But if not, whenever they're done, you just have to clean everything up if they did get some on the bed. So turn the patient on their side helps to maintain an open airway, and it prevents aspiration. Number 25, a patient is scheduled for surgery and needs to be transported to the operating room. What is the nursing assistant's primary responsibility? Is it A, explaining the surgical procedure to the patient, B, ensuring the patient remains NPO and that the chart is transported with the patient, C, starting an IV line, or D, administering preoperative medications? What is your role as a CNA? Yes, everybody. It is going to be B, ensuring the patient remains NPO. They can't have anything to eat or drink. Who usually brings in the food? It's going to be the CNA. Who usually brings in the water? It's going to be the CNA. So don't get tricked. If they have a surgery scheduled, no food, no drinks, and that the chart is actually transported with the patient. And this gets kind of confusing because in most hospitals, we'll have like the OR team, they will come up to the room. But let's say the OR team is busy and this is an emergency. The one thing you don't want to forget is the chart. Because as the nurse, I'm going to have you go right back upstairs and get the chart. Yes, everything is in a computer now, but there is still going to be some written documentation, new lab results, new physician orders. There's going to be a written file that needs to go with that patient. So make sure that you bring that too. So everybody, you know how much I appreciate you all for joining and for learning. You all make my days go by. Just make it so much better. Yes, I have my students here in Jacksonville, but I also consider you all to be my students too. So tomorrow, Karen's video, all 100 and some odd slides, will be done on oxygen therapy. So if you want to learn about oxygen, when to use which device, that will be tomorrow's video. And I hope that you all have a wonderful holiday weekend. And I'll see you tomorrow. Don't forget, like the video, subscribe to the channel. This is Nurse Eunice. Bye, everybody.